to Ian, you know, we've spent a lot of time this year looking at what it takes to have a successful team in the Supercars Championship. Money, of course, plays a big part, but it always comes down to the people. And the team you're about to meet has some of the most incredible people in the sport. It's the Supercars medical team, and Larko has more.
You know, back when I was racing, yeah, sure, I had a few crashes and been carted off in helicopters and ambulances and all the rest of it. So I made it my business this weekend at the Gold Coast to dig in and finally check out who's here and exactly what they do. Bernie, let's go for a walk. Thank you for spending your time with us and have a bit of a look around at some of the kit you've got.
So this is our main trauma bay. So we're set up basically to deal with two major traumas.
To what extent do you work on somebody here before they're actually shipped away and worked on in a hospital or a medical centre?
Yeah, so our job's just to mainly stabilise them to a point where it's safe to transport them out of the circuit. So we have portable monitors that can monitor blood pressure, oxygenation, heart rate, a range of drugs and medications available, because also we treat patients that are unwell for other reasons that may not be race related.
Drivers are pathetic. You must get every snotty nose and headache and everything comes down here.
I do.
Now I know that Betty Clemenco, God bless her heart, donated the money so you guys could have this piece of equipment which is absolutely state-of-the-art and latest.
So this is a portable monitor. It's got a defibrillator. You can do heart rate, blood pressure, all the normal sort of monitoring equipment. This is called a laryngoscope. So if we need to intubate someone, look after the airway, it's a video laryngoscope and we can actually send information to a receiving hospital.
Here's my wallet. I've got 4 kids. Have a look in there. What do you see? Empty.
No.
There you go. In the construction of a supercar, we've actually got rid of all the crumple zones that are built into your road car. So that means whether it's a side impact or a frontal impact, that a lot of the energy from the crash ends up going into the driver's body. There's a little sensor in here called a G sensor, and it's sampling Gs hundreds of times a second. And as soon as it hits a threshold over 20 G at an impact, a message goes straight to race control from the car, and race control can then deploy an intervention vehicle. That's pretty cool, eh? So they've actually typically got 3, 4, even 5 vehicles at an event. Pete's a familiar face for all of us around the traps because he runs this Team Medical Australia operation. Why is it that you follow off the grid and the car doesn't park normally like it does at one of the stations around?
The guys are the closest, the cars are still cold, brakes, tyres, all cold. The enthusiasm up, and if something's going to happen, that's more than likely going to happen in that first lap. So our aim is to try and give first level intervention within 30 seconds of an impact on our opening lap.
And on 2nd, 3rd, 10th and 50th lap, what's your general response time? What's your expectation?
Within a minute to a minute and a half. Typically what we would carry is for an oxygen bag, a defibrillator. We have a single bag which is condensed down, which has got all the drugs and all the other trauma type equipment that's needed. We have our slides for drivers to help get them out of the cars, which are carbon fibre.
I've always been intrigued by this one with the Supercars badge on.
It goes over the roll cage. The spine board can sit on the back here. You can slide the driver out while they're sitting on the side of the car.
Quick final question then. The next thing I need to know is how many people in here and who are they?
Yeah, so Dr. Carl Lee always sits in the front left-hand side there. I drive at most of the events, and we'll always have either a doctor or micro-paramedic in the back.
Okay, so what we're going to set up here is a typical rescue. As I say, we've got Brad Jones' young fellow here, Macaulay, hey Macca?
Right.
If you had an injury, and let's just say you've been T-boned, you're probably like me, mate, I can't imagine how they're going to get you out of there without doing more injury to you.
Yeah, I mean, it's quite a confined space that you're in, as you can see, and it'd be very difficult for them, but, you know, this is why they're trained for what they do.
Well, I'm keen to see, because you see a driver change at Bathurst is difficult enough. So before we even think about the rescue, they're on the racetrack. There could be still cars going past. They're talking to race control. What's going on there? The other expertise they've developed is to understand some of the systems. On every race car, you'll see this blue triangle, right, with the lightning on it. That's power. They've got to disconnect power. You don't want any sparks or power in the car. Extinguisher. Maybe this has always already been extinguished. Then they've got to get the door out of the way. It sits on pins. They've got to get the net out of the way. So there needs to be quite an intimate understanding of the race car. Now, I'm going to get the hell out of the way and let these people do their craft.
So the drivers are making sure that the access to the patient is clear. Our primary medical officer is getting a response from the driver.
All right, so we have a code 2 driver requesting an alpha.
So we've just had communicated back to race control that the driver is code 2. That's the trigger that this is more serious than just a little scrape.
and they communicate they need an alpha unit. So the alpha crew is often the ambulance service from the state that we're in, and they're now loading the driver out onto the spine board because they want to get the driver out of the car. This is what we refer to as a rapid extrication. Remember, we're always doing this where there's cars going past, we're under safety car, it's very loud, it's very noisy, and at this point we would commence the transfer of the patient onto an ambulance stretcher back to the Circus Medical Centre.
So here we are on the back of the grid, right in the thick of the action. The medical car, as you can see, loaded up, and she's ready to go. And this is the guy I wanted to track down, Dr. Carly. Are they different, the injuries that you see in race car incidents, comparative to what happens out of the general population or other sports?
We're seeing relatively minor injuries, as you would know yourself. We're seeing really high energy impacts now, 40 Gs, 60 Gs.
Yes.
Obviously, sometimes it does get through, such as a lateral impact like with Lee Holsworth in Darwin. The one that's still memorable to me in the recent history is Mostert's crash at Bathurst, where not only were we aware that he was in the car and he needed to be rescued, but that there were marshals that needed attending to as well.
Who do you talk to? Who's connected to your CB radio here?
Yeah, we run a lot of radios. This one's on race management, which is directly to the race director. So we do not move without direction from Tim Schenken. We also have a few other channels, and I am listening to the drivers communicate with their engineers. That's often one of the first things for me to know if a driver's injured or not, or if they're not performing well, such as Tim Slade with his issues at Bathurst.
So these people here, I can tell you we've got, well, intensive nurse, we've got trauma people, paramedics, doctors, right down to first aid, and everything in between, there they all are. And guess what? Put your hand up if you're being paid. See that? Every single one of them for free to help these guys on the pit lane. And you know why they do it? Watch this. Put your hand in the air if you love motorsport. Hey? Goes without saying, doesn't it?
Great insight. Thank you to Larkin. They are there for every single round, for every single lap, and we cannot thank them enough, the Supercars medical team. There's more to come on RPM, but first, our latest offer, thanks to Shants.